So this is my caring for respiratory stress situation. Some of these cases may be like asthma attack or someone just having a lot of discomfort when they're breathing after activity especially, but really in any circumstances. This is something that's very important to recognize early. If someone can't breathe, then it's going to be really hard for them to live. So your first step, you're going to activate your EAP. Every facility should have one individualized for that facility. Then you're going to perform your primary assessment. You're going to come up to the patient. You're going to check their airway, their breathing, their circulation. And then you're going to summon the advanced personnel, so which should be part of your emergency action plan, is activating the EMS so that they have an adequate amount of time to get there while you're providing the basis of care that you can within your spectrum. You're going to assist the athlete into a comfortable position, whether that's the tripod or laying on the ground or, arms over their head type of thing. Whatever makes them feel comfortable, you're going to try to assist them into that position. Then you're going to decrease the amount of bystanders. Trying to control a situation like this is important for both you, the athlete, and surrounding personnel as well, just because then you can control everything and make sure that there's no environmental factors that could be playing a role in it right now. So then you're going to have a one-on-one with your patient, get that sample history, so if they're on any medications, if this has happened before, if they have a history of this, stuff like that, just so you get an understanding of what's going on, and if this has ever happened. So like such as if they had asthma, you would know that you need to get their inhaler and provide it for them, or like an EpiPen if they had an allergic reaction, something like that, so you know that you're taking adequate care of the patient, individualized for them. Through all of this, you're going to assess their vitals, try to get their heart rate, their blood pressure, if that's something that you can do. Get like a physical examination, so just some of the basic stuff, not anything too strenuous or anything like that, but just so that you get an understanding. So like skin color, temperature, stuff like that, that can help you understand or maybe diagnose the problem. In this circumstance, if you would need to provide medications or something like that, this would be the time to do it, especially if you had their informed consent and knowledge of them using it in the past. At this point in time, you can also provide supplemental oxygen if necessary, but just so that they have assistance getting that blood flowing, getting that oxygen concentration. This is really important to recognize this early, like I said, just because you could be saving this person's life by knowing those signs and recognizing what's going on, and then getting a deeper understanding of what's going on through those sample question history examples, so that you can administer that EpiPen or that inhaler at the soonest time in order to get this under control. But then you're going to keep monitoring those vitals, especially if medication is administered, until that EMS gets there. Then you can hand off everything that you know as well as the patient and have them get an advanced care of them taken.